Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator with the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Very good, thank you.
Our viewers will remember that Dr. Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be reacting to the latest headlines and COVID numbers, through today, August 3rd. We invite you to submit any questions you have below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting out with those COVID statistics, average new cases per day is around 10,000, could be higher or lower. As we know, we don't get case reporting as we used to. Average new hospitalizations per day is 1,148, and average COVID deaths per day are at 24. New booster proportion, as always, staying steady at 17%. Dr. Murphy, your reactions to those numbers?
Well, like we said last week, they're going up. We don't count them as rigidly as we used to, which is unfortunate, but that's the way it goes. We do count hospitalizations and we do count deaths. The hospitalization is ticking up. And it's not evenly spread throughout the country. There are just certain areas that are more impacted than others. And it's strange that the US sees these upticks in the summertime. You know, like flu typically is in the fall and winter. But it may be that in many places in the summer, because it's so hot, and especially in this year and in many places, particularly in the South, that actually people are indoors more in crowded situations because it's just so hot out. So it shouldn't be too surprising. So, the number of hospitalizations is still way down from before. So, it was as high as 44,000 per day in 2022 in certain periods. No dominant variant has come out. A lot of places are not reporting it, but mostly they're not reporting it because they're not testing for it. That is just part of the issue here. But I think we have to just be careful to see what this supposed uptick in hospitalization increase, what that translates to. Will those people get sick, end up in the ICU, and maybe some of them die, and the deaths per day go back up? Right now, it's pretty low. If you look at the average number of deaths per day for flu, it's 100, but it's mostly in 6 months of the year. So it's like 200 a day and then none per day. It's not quite, but you know what I mean. So it'll be interesting to see really what happens.
Absolutely. And moving on to our first big announcement in the public health infectious disease world, the NIH has selected a new director for the National Institute of Allergy and Infectious Diseases. Can you tell us a little bit about their selection?
Yeah, so the NIH, the acting director of the NIH is Dr. Lawrence Tabak, and he has selected Jean Morazzo as the new director of the National Institute for Allergy and Infectious Diseases. Now that's a mouthful of a title there, but that is the institute that controls all the research for any infectious diseases, and this is the former position of Dr. Tony Fauci. So he held that position for a long time, and then he stepped down at the end of December of last year, in 2022, and she is now has the full-time position leading that organization, which covers everything from HIV/AIDS and COVID and resistant bacteria, and you name it. It's all, anything infectious goes there. They have a budget of $6.3 billion per year. It's one of the bigger institutes, along with cancer and heart disease, and it's huge. So Dr. Marazzo, I don't know her personally. I've heard of her, but she had been the head of the Division of Infectious Diseases at the University of Alabama, Birmingham, and has done a lot of research and led international clinical trials and done all sorts of research in infectious diseases. She has a lot of titles. She's a fellow in the American College of Physicians and the Infectious Diseases Society of America. She got her bachelor's degree from Harvard. She went to Thomas Jefferson University in Philadelphia, where she got her MD, and she got a master's in public health from the University of Washington, Seattle. And she has chaired the American Board of Internal Medicine Council and their infectious disease specialty board. So she's a really highly qualified and experienced person. So welcome, Dr. Marazzo. We look forward to working with you. And that's really about it. So that's a big position, one of the bigger ones at the NIH.
Yeah, and just announced, so very exciting news. And speaking of the NIH and the work that they have going on, there was a big announcement about studies going into long COVID symptoms. And, you know, as Americans have gotten frustrated as we don't have these questions, that's some really big news. So can you tell us a little bit about that funding and what that funding is going towards?
Yeah, so the NIH has just allocated $1.15 billion in funding to learn how to better prevent, test, and treat long COVID. And they have a big trial called the Recover Initiative, and that's all about getting better after you have COVID. So there's many questions, you know, like why do some people get it? Why some don't get it? How bad is it? How do you treat it? How do you prevent it? You know, and so forth. So approximately, according to the Kaiser Family Foundation, 28% of people who've had COVID, which is, you know, most of the country, have had some symptoms that are prolonged and could be classified as long COVID. There isn't even really the great definition, but most of those get better. And like currently, 11% of people have some symptom related to COVID. And so this Recover Initiative has tracked 24,000 patients in observational studies to really help better define this. And, you know, they looked at current studies ongoing right now. They look at prolonged courses like 25 days of the antiviral anti-COVID drug Paxlovid. This is one of the drugs that actually works. And the treatment and recovery, the usual course is 5 days, so maybe longer treatment is better. And there are some treatments floating around for brain fog and other cognitive problems, which can be very debilitating. And there's this post-science core brain HQ cognitive training program and other things they're trying. One of that's at Mount Sinai Health System. And all sorts of things are actually ongoing now. And then the future studies will look at sleep problems with autonomic nervous system. They have nervous system problems, and exercise and fatigue studies are also planned. So $1 billion is a lot of money. And you're going to see a lot come out of that.
Absolutely. That's really great news. And hopefully we'll start getting some, you know, concrete answers on some of these aspects of long COVID. But moving on to our next story, there has been a lot of talk about mosquito-borne, you know, viruses, diseases this season. And West Nile virus has not been talked about as much, but is still causing some concern. Can you explain why that is?
Yeah, so West Nile has been around for a long time. Illinois is actually one of the bigger reporting states because we actually have a really good reporting system. But there's only been 69 cases this year. They had a peak in 2003 where there were 9,000 cases. So, you know, it happens. So what happens when you get West Nile from one of these mosquitoes? Well, only 20% get sick, and they get typical flu-like symptoms like fever, aches, vomiting, diarrhea. and the symptoms occur usually very typically within 2 weeks of getting bit by one of these infected mosquitoes. But less than 1% really get severe complications, which can include death. Sound familiar? 1%, that's like COVID. But anyone can become severely ill. So, and the typical people are at risk for West Nile, which is older, over 60 years of age, especially if they have underlying medical conditions and they are at higher risk for severe infection. And it's thought that the combination of this very rainy spring and summer that we've had, melting snowpacks and intense heat waves, that this is going to dramatically increase the mosquito populations that are going to spread COVID. West Nile virus, excuse me. I've got COVID on the brain here myself. But, and unfortunately, some of the insecticides they use for mosquitoes are becoming resistant to many of the sprays. So it's this is a combination thing that is not good. But West Nile is well known. There had been a vaccine developed for it. Nobody wanted to take it and nobody wanted to market it. And so it just was abandoned. But, you know, if this thing changes, if the mortality rate goes up or becomes even more infectious, you know, we'll see.
Absolutely. It's definitely something to keep an eye on, especially if you're traveling to warmer or wetter places. And our next and final story for the day is about a longstanding issue that those in the medical community have been discussing. And it relates to the kind of existential threat to modern medicine that is antibiotic resistance. Could you explain to us just a little bit about that and why it's in the news now?
Well, the problem with antibiotic resistance has been going on for a long time. Even when I was in medical school, you know, it was always an issue. And the last available hard data we have is from 2019, and that data set, 2.8 million Americans had antimicrobial drug-resistant infections. And this resulted in about 35,000 deaths in the United States. And worldwide, it's estimated about 5 million people die of drug resistance. So this is not a problem just of the United States or high-income countries, it's everywhere. Antibiotics are used around the world, and misuse of them, overuse of them, inappropriate use of them is just aggravating the whole thing. So what's going to happen? You know, we were sort of making some progress. This is due to enhancing the appropriate use of antibiotics in many hospitals. So the hospitals have gotten on board and how to, like, you know, limit the use of antibiotics and to prevent this resistance from occurring. And so the rate was actually going down until the COVID pandemic came, and then the hospitals were just overwhelmed with all these sick people, and they were all getting antibiotics as well as everything else and other infections. And so that there's been this big increase now in resistant hospital infections, and they increased at least 15%, supposedly, because of the pandemic. So the UK, for example, they actually signed contracts with drug makers, Pfizer and Shionogi, guaranteeing them a fixed annual fee up to $13 million for the next 10 years. So that's like $130 million if they would develop a couple new antibiotics. So this is in addition to the money they would make from selling the antibiotics. The problem is why the companies don't want to make antibiotics is they don't make money on the antibiotics. You know, most of the antibiotics out there now are generic. And when they make a new antibiotic, to make that antibiotic really effective, you limit the use and only use it where you really need it. Well, of course, you know, if a company is going to make a drug, they want to sell it. So there's this, you know, just an issue here that, you know, if we want companies to make antibiotics, somebody's got to pay for this development. So there's all sorts of lobbying going on right now for Congress to do similar things what the UK is doing And, there can be some other kind of economic incentive to pour into resources to develop to develop better antibiotics. So, we've been talking about this for a long time. It's, unfortunate, but it's time to step up to the plate, because if we get these super bugs, the hospitals are going to end up being very dangerous places. They are already very risky. And we don't want to put more than, 35,000 people a year in the United States are dying. I mean, that's like the flu deaths now, So, and this is, it's a man-made problem. So I think the incentives hopefully will work, or, the development of these antibiotics would have to come from a non-governmental organization source, some not-for-profit source. But, the drug developers already exist in these companies, and we should utilize those resources, and hopefully they can get some incentives, in place that will foster the development of better antibiotics, so that we can be safer in the current hospital situation. So it's a big problem. You'll be hearing more about it for the next many years, until something is really done about it. I think this is at least a step kind of in the right direction.
Absolutely. It's good to see that there are steps being made and that it is being advocated for here as well. And hopefully we will see some action in that regard. And on that note, wrapping up, I'd like to thank you, Dr. Murphy, for your time and expertise addressing all of these headlines and COVID numbers.
Great. Thank you.
Thank you. And thank you to all of our viewers for joining us once again this week. If you have any questions, please don't hesitate to submit them down below by email at globalhealthinstitute@northwestern.edu or on our Facebook page at Global Health Institute. Thank you.
Thank you.